Ever experienced a sharp pain radiating down your lower back to your leg? It could be sciatica. Sciatica, a term you may have heard before, is more common than you might think. It's not a medical condition in itself, but rather a symptom of an underlying medical issue. It's like your body's alarm system, alerting you that something isn't right. But what exactly is sciatica? Imagine a large river flowing from your lower back, down your hip, and along your leg. That's the path of your sciatic nerve, the longest and widest single nerve in your body. Now, imagine a stone obstructing the smooth flow of the river. This stone represents various medical conditions that can irritate or compress the sciatic nerve, causing sciatica pain. This pain is often described as a sharp, searing, or burning sensation, and it doesn't stay in one place. It originates from the lower back or hip, and then it travels, radiates down the leg along the course of the sciatic nerve. The pain can vary in intensity from a mild ache to a severe, debilitating pain. It can also be accompanied by other symptoms like numbness, tingling, or muscle weakness in the affected leg or foot. So who's likely to experience this? Well, sciatica is quite democratic. It can affect anyone, regardless of age, gender, or fitness level. However, it's more common in adults and tends to be quite prevalent in people who sit for long periods or those who have a history of back problems. Understanding sciatica is the first step in addressing it. It's essential to remember that sciatica is not the problem itself, but a red flag your body raises when there's trouble in your lower back or hip. Now that we know what sciatica pain is, let's delve into what causes this discomfort. So, what triggers this radiating pain known as sciatica? Let's delve into the various causes of this discomforting condition. One of the most common culprits is a herniated disc. This occurs when the soft inner part of the disc protrudes through the outer ring. Picture it like a jelly donut, where the jelly pushes out through a crack in the dough. This can irritate the nearby nerve root, leading to sciatica pain. Next, we have spinal stenosis. This is a condition where the spaces within your spine narrow, which can put pressure on the nerves that travel through the spine. Imagine a river flowing through a narrow canyon. If the walls of the canyon close in, the water's flow is affected, similar to how nerve signals may be disrupted. Then there's spondylolisthesis, a condition that occurs when one vertebra slips forward over the one below it. It's like a misaligned stack of blocks, where one block slides forward, disrupting the stability of the entire stack. This misalignment can compress the nerve and instigate sciatica. Finally, let's talk about piriformis syndrome. The piriformis muscle is a small muscle deep in the buttock. If this muscle becomes tight or spasms, it can put pressure on the sciatic nerve. Think of it as a tight knot pressing against a rope, causing discomfort along its length. Each of these causes has a unique way of irritating the sciatic nerve, leading to the pain we know as sciatica. It's important to remember that while these are common causes, they are not the only ones. Other factors like pregnancy, muscle spasms, and even sitting for long periods can also contribute to sciatica. The human body is a complex network of interconnected systems, and when something goes wrong in one area, it can have far-reaching effects. Just as a stone thrown into a pond creates ripples, so too can a problem in the spine ripple out to cause sciatica. Understanding the causes gives us a clearer picture of sciatica, but how do we recognize it when it hits? Recognizing sciatica is crucial to managing it effectively. Let's delve into the common symptoms of sciatica. One of the most prevalent signs is lower back pain, which can manifest as a mild discomfort or escalate into an unbearable ache. This pain isn't confined to the lower back. It often radiates to the hip, causing discomfort and making movement challenging. The pain, however, isn't the only telltale sign of sciatica. A burning or tingling sensation down the leg is another common symptom. This sensation might feel like a jolt of electricity, a sudden shock running down your leg, disrupting your daily activities and making even the simplest tasks a hurdle. Weakness is another symptom of sciatica. If you're finding it difficult to move your leg or foot, or if you're feeling a sense of numbness, it might be due to sciatica. This numbness can be frustrating, making it hard to go about your day-to-day tasks with ease. One crucial thing to note is that the pain can vary widely. It can range from a mild ache, something you can shrug off as a result of a long day or strenuous activity, to a sharp, burning sensation that's impossible to ignore. It can also manifest as excruciating pain, a relentless torment that disrupts your sleep and makes it hard to find a comfortable position. Sometimes, The pain might be intermittent, coming and going without any apparent reason. Other times it might be constant, a steady throb that reminds you of its presence with every move you make. Regardless of its intensity or frequency, the pain from sciatica can significantly affect your quality of life. If you've experienced these symptoms, you might be dealing with sciatica, but don't worry, there are ways to treat it. Suffering from sciatica can be tough, but effective treatments can help manage the pain. When it comes to treating sciatica, a multifaceted approach often works best. The first line of action typically involves medication. Over-the-counter pain relievers and non-steroidal anti-inflammatory drugs, or NSAIDs, can help to alleviate the discomfort and inflammation associated with sciatica. In more severe cases, doctors may prescribe muscle relaxants or even opioids to help control the pain. However, medication is only part of the solution. Physical therapy plays a crucial role in treating sciatica pain too. A skilled physical therapist can design a customized exercise regime to strengthen your back and improve your posture, which can help to relieve the pressure on your sciatic nerve. These exercises may focus on improving your flexibility, building strength, and promoting better posture. In some severe and persistent cases of sciatica where the pain doesn't improve with conservative treatments, surgery may be considered. This could involve removing the herniated part of a disc, removing the bone spur that's pressing on the sciatic nerve, or in rare cases, removing the entire disc. While this may sound intimidating, it's important to remember that surgery is usually the last resort and is only considered when other treatments have failed to provide adequate relief. But as with many medical conditions, prevention is always better than cure. Regular exercise, particularly those that strengthen your core, can significantly reduce the risk of sciatica. Maintaining a good posture, especially when sitting for extended periods, is also crucial. It's all about keeping your spine healthy and robust to lessen the chance of any nerve impingement. In conclusion, managing sciatica pain involves a combination of medication, physical therapy, and lifestyle changes. And while surgery is an option in extreme cases, it's not the first solution to jump to. It's also essential to remember that everyone's experience with sciatica is unique, so what works for one person may not work for another. With the right approach, managing sciatica pain is possible. To wrap up, let's summarize what we've learned about sciatica pain. Sciatica pain, as we've discovered, is a distinct type of discomfort that radiates along the path of the sciatic nerve, which branches from your lower back, through your hips and buttocks, and down each leg. It's a condition that typically affects only one side of your body. Now, the cause of this ailment is something we've talked about in detail. It often occurs when the sciatic nerve becomes pinched, usually by a herniated disc in your spine or by an overgrowth of bone on your vertebrae, known as a bone spur. Other conditions like spinal stenosis, piriformis syndrome, or pregnancy can also cause sciatica pain. The symptoms of sciatica are fairly distinct. We've learned that it often starts with pain in the lower back, which then travels down the leg. It can be a mild ache to a sharp burning sensation, and sometimes it can feel like a jolt or electric shock. Numbness, tingling, and muscle weakness in the affected leg can also be symptoms of this condition. Treatment, of course, is crucial. Mild sciatica usually goes away over time, but if your pain lasts longer than a week, is severe, or becomes progressively worse, then it's time to see a doctor. Treatments can range from physical therapies and exercises to medications and even surgery in severe cases. The importance of recognizing these symptoms early and seeking professional help cannot be overstated. Not only can it prevent the condition from worsening, but it can also help you return to your normal activities sooner. So, there you have it. We've unraveled the enigma of sciatica pain, delved into its causes, identified its symptoms, and explored the possible treatments. It's a lot to take in, but it's crucial information for those who are dealing with this condition or know someone who is. Remember, understanding your body and staying informed is your first step towards a healthier, pain-free life.